Why do TIA symptoms mimic other conditions? Imagine experiencing sudden weakness or a strange vision change and wondering if it's a stroke or something else entirely. Transient ischemic attacks, often called mini-strokes, produce symptoms that can look just like many other medical issues. That's because many neurological symptoms are not unique to TIAs. When blood flow to a part of the brain is briefly disrupted, it causes sudden problems like weakness, numbness, speech difficulty, or vision changes. But these same signs can also happen with migraines, seizures, low blood sugar, or even anxiety. For example, a migraine can cause visual disturbances and sensory changes that seem very similar to TIA symptoms. Since the brain reacts to different problems in similar ways, it's often hard to tell what's causing the symptoms just based on how they look. Another reason is that TIAs are by nature temporary. Their symptoms usually last less than 24 hours, often just a few minutes or hours. By the time someone gets evaluated, the symptoms might have gone away completely. This fleeting nature makes it tricky for doctors to diagnose because they can't always see the signs on scans like MRI or CORT. And like a stroke, which leaves permanent damage visible on imaging, a TIA often leaves no trace. So, diagnosis depends heavily on what the patient reports about how they felt and what symptoms they experienced, which can overlap with many other conditions. Symptoms like confusion, headache, or general tingling are also common in conditions that are not TIAs. These non-focal symptoms are seen in a variety of neurological or systemic illnesses, making it even more difficult to pinpoint the cause. Plus, many patients with TIAs have risk factors like high blood pressure, diabetes, or irregular heartbeats. But these risk factors are also common in other neurological issues, so they don't necessarily mean a TIA is happening. Studies show that between 9 and 31% of suspected TIA cases are actually mimics. Migraines are a frequent cause, but seizures and other transient neurological events also contribute. Because of this high rate of mimics, doctors need to perform careful evaluations. This includes detailed history taking, neurological exams, and sometimes imaging or vascular studies to help distinguish true TIAs from other conditions. In the end, the main reason TIA symptoms mimic other conditions is that many neurological disorders produce overlapping transient symptoms. Without a definitive test, diagnosis relies on a thorough clinical assessment. Recognizing a TIA quickly is crucial because it signals an increased risk of a future stroke. Prompt treatment can help prevent a major event. That's why if you experience sudden neurological symptoms, it's always best to seek immediate medical attention. Remember, only a healthcare professional can accurately diagnose and guide appropriate treatment.